All right. Well, welcome everybody. Thanks for joining us. Just a few housekeeping items before we get started today. Today's session will be an hour with time for Q&A throughout the session. This webinar will be recorded for future viewing. So please note that participation in this webinar qualifies for free CME credit, and the CMA link will be provided at the end of the webinar and on our website after. Any resources maybe that are mentioned during this call today will be made available after. And we'll encourage questions and comments, so please submit those using the chat function. And if you'd like those asked anonymously, just send them directly to myself, and I'll ask those at the end. The panelist today has no financial relationships to disclose, and this is available for 1.0 AMA PRA Category 1 credit. So I am really pleased to introduce our guest today. Dr. Libby Crockett is an obstetrician gynecologist at the Grand Island Clinic and a Nebraska native who grew up near Minden. She completed her medical degree and OBGYN residency at the University of Nebraska Medical Center and later earned a Master of Public Health while serving on faculty. In 2016, she and her husband, oncologist Dr. David Crockett, returned to central Nebraska to raise their three children and establish practices closer to family. Her passion for physician advocacy stems from seeing key healthcare decisions increasingly made by those outside the profession and recognizing how hard it can be for physicians to stay engaged. She founded the Nebraska Alliance for Physician Advocacy, which builds advocacy skills, fosters community, and amplifies physician voices through its podcast, blog, research support, and events. So welcome, Dr. Crockett, and I will turn it over to our medical director, Dr. Schaefer.
Thank you.
Good morning. So I want to start out first with just asking you, how do you define physician advocacy and why is it so important?
That's okay. Well, I think people always think advocacy is just like this very narrowed activity of a legislative process where you go and you talk to legislators. And of course, that's a really important piece of advocacy, but it happens at every single level that honestly where we work. We do so much advocacy just in our day-to-day lives. I mean, it could be from you know, getting a consult when you need it for a patient. It could be, talking to an insurance company. It could be, negotiating a contract for your job or negotiating for recruiting a physician into your practice. It could be a number of those things. And so I think it's really important for physicians to realize that they have inherent really good advocacy skills because of the how I would say how we were raised. I think we call it training, but I think sometimes it's like we grew up in medicine. And so how we grew up in medicine and how we were trained and raised in this system, there's a lot of obviously negative things that come up, and we spend a lot of time talking about that. But I think we also inherently get a lot of just good advocacy skills if we really can kind of filter through and understand what those things are. We can apply them even more broadly to really be impactful for us and the people we're taking care of in our communities. I I especially saw this during COVID where it was really clear. I'm not sure I paid it as much attention before that. I think I was aware that, oh, okay, these things happen. I have a background in public health, so there was a lot of kind of policy training with that education. But in COVID, it became very clear that people that don't have any background in healthcare and medicine and science are making a lot of decisions that really impact what we do day to day. And it's extremely hard. I don't have to tell any of you guys to find the time to engage with it. And these things happen without us even realizing they're happening. And so being able to kind of pull back, I think people still really trust physicians, especially I think it's gotten even crazier in the last couple years. But I think people do still really trust the physician voice. And so I think the more we can amplify that, the better. But it is hard just because of the limitations of our time.
When we talk about levels of advocacy, you touched on this a little bit, but I think sometimes people forget we used to talk about it as being in the policy world myself for a while. we used to talk about big policy, big P, and little policy, little p. But just if a physician looks, and you can comment on this about your thoughts, if they just look in their daily world, there's little policy starting in their office,
Mhm.
and there's the next layer of policy starting with the administration where they work. Then the
Mhm.
next policy they could jump to is the policy in the city that they live in,
Mhm.
or even just their, I mean, you could start even lower than that, their HOA,
Yeah.
that's affecting their life. Then their
Mhm.
city, then the state, then the regional policy, like multi-state agreements, and then the federal policy, and then national policy. So can you comment a little bit about that, about the different levels of policy and this, maybe the skill sets or the knowledge base that goes into that, and where physicians can interact in those different levels and slide between them a little bit?
Yeah, I mean, I think when you just like when you list that out, I was even getting a little heartburn thinking about just like the vast level of like what happens. And we sort of can kind of feel like we don't have any control over it or agency in what happens to us when you start kind of just like getting like real macro about it. But you're right. Like I think you can also spin it of like, okay, I might not be able to affect what's happening in Washington, D.C., but I could, you know, talk to the school board or I could talk to city council and I could, you know,
More.
I can do these things. I think, that came up a lot in COVID. Would have never dreamed of going to a city council meeting in the past, but I showed up and I talked about masks. We talked about the pros and cons. Like we were a resource for superintendents, and I think those things take time and they're hard. I think in the past, I don't know, I didn't live in the past, but it seems to me that there was a lot more kind of administrative help for physicians in the past, and now we're responsible for so much like minute to minute tasks in our day, like physician order entry and those sorts of things. And I think that makes it harder to get involved. I think there's a lot more um focus on family. I think for both men and women in younger generations than there was, 40 years ago in medicine. I think a lot of times it was a more male dominated specialty, and I'm not sure. I think the family life was maybe left more to the CEO of the house of maybe the female. I don't know. I'm speaking pretty generally, but I think that's what I see. And I see, our household, it's a two-doctor household, and my husband comes home and makes dinner. My schedule's way crazier than his, and so he has to do and loves doing it more family care, but that means there's just less time for both of us to be involved in doing things. And so I think looking at what you can achieve, can you go to a meeting once every couple of months and be involved or be a resource, just make a connection with people so that they know that they can pick up the phone and say, "Hey, I have this question. We are talking about this thing," and that they can pull your opinion into those loops without you even having a formal position in those places, makes a really big difference. Um, Keeping just kind of a subtle, like a small list in your head, maybe it's a real list that you keep of just people that you've known. We have a huge connection resource. We've worked with so many um, different physicians in our training. Like I, between college, going to college here and medical school here and residency here, I have a lot of just peers that I know, and I have enough understanding of their interests and their knowledge base that, if something comes up, I can reach out to them and say, "Hey, I don't know if you knew this was happening. It's totally out of my wheelhouse, but I just wanted to loop you in and just connect you with this person because I think, and be aware of time, like I told him that you don't have a lot of time, but if you wanted to reach out and give somebody an opinion about this might be a really good opportunity. So kind of keeping those things in mind to build that community, I think is also really helpful. You don't have to, we're not living in a vacuum. You don't have to do it all yourself.
Yeah. Yeah. And we'll talk about effective strategies in a minute, where I want to touch on relationships and how important those can be. But thanks for touching on that. So, getting started, for physicians who feel, and you talked about this a little bit, too busy or unsure where to start, what are just some small, meaningful steps that physicians can take?
Yeah, I mean, I think just starting to learn a little bit is helpful. There's a lot of resources here. We um, the Advocacy is Medicine podcast that Nebraska Alliance for Physician Advocacy puts out has a lot of just like trying to basic education of the unicameral. I know a lot of that government stuff was a long time ago in my education in Nebraska. Fourth grade was many, many years ago. And so it's helpful to kind of go through and review some of those things so you don't feel so intimidated. Um, Asking if you see something, just reaching out to somebody else you know that's involved, because usually people who are involved are really excited to have other people interested and are willing to help navigate that process for you. A lot of times they might have a contact in an office where they can help you get established and build a communication with either your legislative representative or maybe there's a legislative representative that's either championing your cause, or maybe they're trying to pass legislation that's not supportive, or you're not in favor of, and can help create some of those partnerships so that you can talk about it. Um, I think understanding kind of like what you want out of the experience is also really important. Are you somebody who wants to be like really recognized and be present, or are you somebody that just is really comfortable kind of navigating stuff in the background? Um, and just kind of knowing that there's a lot of levels to be involved. You don't have to be a podium speaker or be the face of things. You can actually, kind of low key do a lot of really important work. And I think understanding there's a lot of people doing a lot of really important work without having their face on, being presented or shown is also really important to remember. I don't know. I'm not sure if I feel like I got a little bit in the weeds there, kind of
No,
lost
that's okay.
the
That leads
question.
into the next question I was going to ask. So, you touched on it, but what are other misconceptions about advocacy that people need to understand, or, common barriers that they might encounter? I know a lot of people, but you touched on it, like there's a lot of background work in advocacy. It doesn't mean you have to be out there carrying a poster or showing up to testify. There's a lot of stuff people can do that it's really quite helpful, and may not take a lot of time, but it's still helpful to a cause or an issue.
Yeah, I think physicians in general are particularly prone to not wanting to look silly or dumb. And I think that there's an intimidation factor if you're talking in a hearing about what you might be asked, or feeling like you don't know the process and not feeling safe or secure in that situation. I know for me, I really hate conflict. Like I don't know if you guys know Enneagrams. I'm an Enneagram 9. Like, and so inherently, anything that's involved in politics seems really uncomfortable for me, because I think there's so much conflict modeled in what's currently happening. Um, but I think like the best things that happen are when there's people who have two views and you can come together and really negotiate that. And I think that understanding we have those skills. I mean, I just think about sitting and listening to so many panels over the years in medicine where people have different views of the same evidence, right? I mean, I think we've all probably sat in these
Mhm.
discussions and, people had this discussion like, well, this paper showed this, and they were civil discussions about how this could be viewed or done, or what are our problems, or how do we reach consensus. And I think we can really bring that into policy, right? Like that's a lot of background experience that we have that we can bring forward, that doesn't have to be um combative or like verbally violent, or that sort of thing. I think people are really worried about how other people will view them if they put themselves forward on a particular um, issue, especially if that's an issue that's contentious, or they feel like it'll affect their relationships with maybe other physicians, their partners in their community. And I think it's just important to like understand that as a physician, we have really clear views because of our jobs. We see things that other people just do not ever see because of what we do and how we interact with other people and other humans in very, very vulnerable times in their lives. And I think just understanding that we have to trust each other. Like when a doctor says, "This is what I see in my practice," like this happens and this policy change is going to create these problems, that recognizing that and sort of supporting that when other people bring those forward, even if it's not your specialty, is super, super important.
Good. So more on the lines of strategy, what are strategies you found that have most effective in communicating with policymakers?
Um, I think I'm not super savvy and I don't have a lot of connections in terms of like what's happening actively at the Capitol. So I really need a proctoring system. I need other people who have those connections to build those for me, and to kind of create that infrastructure. I it's the staffers, there's staffers in every office and they're usually the point of communication, and it's totally okay to reach out to them and introduce yourself. Um, just creating relationships with your own representatives is really important. I think if we could get more legislators in doctors' offices, especially in outstate Nebraska, I think it would be fabulous if they could see what we're doing day to day and how our systems work. I think that that would be really beneficial. Um,
Can I just put a plug in for that? I think when they're not in session, senators, usually have other businesses and other jobs that they're doing. But they do want to get to know your area. So I highly recommend inviting them to your office, sitting down, having a coffee with them, and letting them know that you can be a resource and building a relationship, because it is really, really important to have a relationship before a crisis or before an ask. Or just becoming their kind of expert at the pick up the phone saying, what do you think about this? And that can be done so effectively with a physician. And then, you said it, have the relationship with the legislative aides. They are very smart and they know their stuff. And when they don't know something that is in our world, it's really important to reach out to them and give them the factual information, the articles. They will read them. They will study up, especially if it's a bill that their senator is pushing or opposing. So the senator may not always meet with you when it's legislative session, but off session or before session, it's a prime time to build that relationship, and it sure makes it a lot easier before things are rolling.
yeah, and me also just piggybacking off of that, I think, if you don't, if you reach out and you're not hearing from the senator or the representative directly and you're hearing from a staffer, don't take that personally and don't like don't disrespect this person who is reaching out to you. Actually build a relationship with that person.
Exactly.
Because number one, they a lot of these people are want to be in politics someday themselves. So they may be your representative someday, many years down the road, number one. But number two, they are doing all that background work right now in that office, and they're kind of keeping the person that they're working for, they know where they're supposed to be at what time and what things that they're prepping all of their bullet pointed information. And so the better relationship you have with those staffers in the office, the more you're going to be brought forward to the representative too.
Exactly. Exactly. They are key and they are smart. I mean, I worked for 11 years in down there, and the staffers are key. And I worked with, they are very professional. They do go on to run agencies, become, senators themselves. They're very, very important. They stay in that world. So developing relationships with them is not only fun, but very helpful. And you'll learn from them as well. They can help you navigate. They will make connections to other senators that you need to know and other staffers that you need to know for your cause. So they are very, very helpful and very, very professional and smart.
Mhm.
So how can physicians frame their stories or data in a way that resonates beyond the medical community? This is a big one.
This is big, and I think that this is a really important thing when we talk about physician advocacy. It's like this is only the physician's job to do. But the problem is if we don't have the general public behind us, the things that we're motivated for, there's not enough of us to swing that kind of the heavy mass that we need to force or change those policy decisions if the general public doesn't hear what we're saying and support it and champion us. And so I think it is tricky. I think it does require you to step out of your comfort zone a little bit. It requires you to engage in various positions where people can hear what you have to say about what you're talking about in a more public way. That might be, I mean, people use social media for that. People uh, go to city council meetings for that. People um, explain to patients like when they're facing a particular issue and say, these things are happening right now and you're in the situation because this is happening or happened at the legislature. Your senator really needs to hear your story. Um, and helping them do that if they're willing to do it. Sometimes people aren't, and that's fine, don't push it. But just making people aware, I think, because I've had a lot of patients over the years like, I had no idea, I can't, this is crazy. Why am I doing this? And I'm like, well, this is the situation. Here are your, I said, here are your senators' names and here are their email addresses. And people are like, I will write them. I don't know if they did or not, but, like facilitating that level of, patients being able to tell their own stories is really important. Um, I always, I don't, I really don't bring politics to patients unless they are like, this is really affecting me. What do I do? And then I will provide those, that infrastructure. But I certainly bring my patients to my politics in terms of like my experiences of physician totally have 100% shaped my views about what's happening and what could happen one way or another. I think I think so many times we forget to use our creativity about what we kind of do the same things over and over and over again. And if they're not working, we still tend to see those same things happen over and over again. What can we bring that's new and novel approaches to things is really important.
One thing I found in terms of trying to communicate a large amount of information in a small amount of time, because you don't really get a lot of time to convey a message, is you got to lock it in and
Mm-hmm.
be tight with your message. And having had to provide those communications many times, it really is true. You got to say it in one page. The world runs around one pagers, and a picture is really worth 1,000 words. So if you can get your data on a map or in the senator's district, um, show their district compared to the rest of the state of Nebraska or nationally, when you have that data honed in to a tight map or some sort of picture or some sort of graph that is factual and backed up by data, and then you can have several bullet points. That kind of tight message, or if you know it's out there, if you can work with someone to make sure your message is tight like that, you really do have to have it nailed down. It doesn't mean that you can't build a relationship. And I'm talking about when you're doing serious advocacy and you've got all your ducks in a row. When you have that moment, you want to be prepared and have it down to a one page. And pictures help, bullet points help. And then you have the background information and the papers in the back if they want more information, because the staffer will look at it. But that one page is so important when communicating, and you can start with a story, you can back it up with data, and then you can put the bullet points and the ask at the bottom. But those things really do matter. And the tighter your message, the more likely it is to be read. If you go in there with a thick pack of, documents and you expect somebody to read 60 pages about why your issue is so important, it will not likely be read because they have, I mean, how many bills are introduced each session? you know, there's just no time to read that. So you got to lock it in and get your message tight for them to even give you the time of day. So, so that's really helpful.
Yeah, I think we tend to try to see the whole picture too, like when we're thinking about things, like, and just that can be really hard to hone in sometimes, but
Yeah, yeah. But it's a team sport. So, maybe when we talked about how, you don't have to be the person testifying, but maybe you're the person that's doing the background information, or like you're the person that's really good at making a graph. And you can spend a little time, working at home on your computer, helping build the information that somebody needs for that one pager. So that's why advocacy is in so many different levels, and you can play just a little part to help something get done.
yeah, for sure, for sure.
So, what role does collaboration with organizations like Alliance, NMA, and or LifeBridge play in a successful advocacy?
Yeah, I think they all have different roles, right? I mean, they all have different it comes down to relationship, different people doing different things. Um, in terms of relationships, like is it relationships with the legislature directly? Is it relationships with other agencies? I think this is something, a voice that's really missing right now is like there's a lot of nonprofit agencies doing a ton of healthcare advocacy. And I really see that the physician voice is missing from those places. And they would love to have it. Um, and just reaching out, you probably have those connections more than you realize, locally for yourself to reach out to these organizations and say, hey, I love the work that you're doing. I think you support my patients, you support our community. How could I be helpful? They can usually they have more resources to be able to help structure you, and they can often make it very easy. I think if you're looking at time factors and trying to make things as easy as possible. When you have that support, they can say it's this day, it's at this time. Or they can say, we don't know what day it's going to be. It's going to be this week because that sometimes is a lot of what happens at the unicameral is if you're talking about the committee hearings, you often may not know exactly what day it's going to be or what time, but you might have a window. And then you can kind of set up maybe three or four different doctors with different schedules, and you might be able to say, okay, we know it's this week. If it's going to happen this day, you can go. If it happens this day, you can go. And everybody can kind of hold that time for that meeting. And maybe in the background, you're working on that kind of one page ask together on a Google Drive document or something that you can all access, even though you live in, 200 miles apart. And just kind of strategizing a little bit that way and communicating, and then using the infrastructure of other agencies that are already doing this work to add so that your voice isn't duplicating and your story isn't duplicating something that they're already hearing, that what you are saying is unique and important. Because I think that that's also a thing to keep in mind is when it's time and bullet points, also different points from different people are really important, and sticking to your voice and your what's important to you or what your expertise is saying, so that you're not duplicating the same thing over and over again, to be respectful of that time.
Good. You said something that made me think, yes, they value our voice. They want our voice down there, and our voice is often absent. And there are many other working healthcare entities down there that are at the legislature every day. Every day they're working their relationships. And I'm not saying that, physicians should take the time off to be down there every day, but I just want you to know your competition is. And they are working it every single day. And you wonder how some bills get passed. That's how they get passed.
They show up in an office with a cup of coffee and
And cupcakes.
and cupcakes here.
Yep,
Yep.
they're there every day. They're working it. And and I don't know how we combat that because physicians are very busy and they're seeing patients every day. And the NMA does an amazing job of working those relationships, but they can't do it alone. So we have to strategize around what that means for how we apply our voice. And, the Alliance has done a phenomenal job of training up some people. So thank you for that. And, we just need to keep going forward because the voice is missing and we are the experts. And we do know our subject matter better than anyone because we're treating the patients, you're treating the patients that and helping the people. So we have the most information on the subject matter. But it's a struggle everywhere. It's not just unique to Nebraska. It is what it is. But the more work we put on it, the bigger the payoff will be. Um,
I I think sometimes too, there are things that come up that we think that's so obvious that can't even be a thing. And so we don't even think about it being something we should speak up about because it seems so silly. And
mhm.
then it passes because
Yeah,
we didn't even like email or say, hey,
yeah,
this from a medical standpoint, this is silliness. Like it's just I don't have another word for it, but just silly. And now it's, codified. Um, and I think understanding those still, not speaking out, those things happen because they don't have a background in
yeah,
medicine.
yeah. So I just wanted to back up and ask you, what inspired you personally to get involved in advocacy? Where did it start?
Um, I think I think my first introduction would have been when I was getting my master's in public health and kind of just like learning some basic skills, uh how to write op-eds, how to frame we didn't mention that before when you asked me about how to get your voice out, but op-eds in your local newspaper are a fantastic way of bringing your voice to a community level about a particular issue. And so making sure that you use that and people can help you write those if you're nervous, like, we can ghost write those things in the background. And if you read it and are great, then you can put your name on it and you don't have, like those things are doable. Um, but just kind of learning about what are those tools look like? What does the legislature look like? Being kind of helped to go to a committee hearing on a certain topic at that time. It came up and I thought, oh, it was, I think, workplace, uh, um, it was about actually I think it was like allowing time for breast. It was like some of the basic early breastfeeding allowances that workplaces needed to be put in place at the state level. And so it was really not a contentious issue. I remember going down in the hearing was like no big deal and it was like zero opponents, I thought, "Oh, this is easy." And so I think my first interactions were really kind of not contentious. They were really comfortable. They felt really easy. And so I think that that helped kind of just give me some basic background information. When COVID came and it was March, it was very clear we had COVID in Grand Island. And all of the focus really was in Omaha from a political level. It was really just like, here's Douglas County, here's the governor in Douglas County. And it was like we knew it was in our clinic, we knew it was everywhere. We couldn't test for it. We're like, this is what is happening. Um, and people, we had a Facebook group in Grand Island. Started just this like group of like, how do we plan as healthcare workers? Like, what is this going to look like as this moves through? Are we going to have to use each other's office resources? Because supplies were in short supply too. Like we couldn't get PPE, remember? So we were like, well, are we gonna have to share PPE between if the dental office is closed, can we set up a system where we can buy masks and bring those in or put their staffers to work if we need to because we don't have enough workers? Like what does that look like? And I think that that pulled a lot of people in that otherwise may not have been interested or known what to say or do. Um, um, and just realizing there was just being able to communicate clear messages about this will be okay, but these are the things that, these are the things we don't know, but these are the things we do know, and this is what we can do. Like we're not helpless in the situation. We can do these things, and we just do them over and over. And just giving that messaging to the community, I think really was impactful. And I sat on these Zoom calls with physicians across the state that would never have talked to each other otherwise. There was, no reason for us to be in the same room otherwise, but we all had really unique viewpoints and together, we were able to do a lot of really that background kind of advocacy work. And, when you look at national data of what happened, Nebraska fared so much better than we should have done. Like, we just did so much better in terms of mortality and morbidity with like those peak COVID. And I know it was because of all that really invisible work that those people were doing in the background of like, okay, these nursing homes are struggling. Like, how they don't have any of these resources and they're scared to death about their residents. So, like, can we get experts to come in and create some just like protocols for these nursing homes? Like, the meat packing plants need help because they cannot shut down because that's a huge economic problem in Nebraska, right? So, like, how do we keep the lines safe to keep people at work? Like, what does that look like? Um,
Yeah.
and I think that was really, I mean, it was important. And I don't think the general public knows that data. They don't look at that data, but I see it and I saw how effective it was because like I've looked at all the national data and what we did worked. And so when you can see that like just some basic like Zoom meetings, right? Like an hour, but then what you each took into your communities saved so many lives. Um, I think that that's like super motivating, right? Like that's to take with you forever. Um, and so yeah, I think I don't know. That was kind of the thing that sold it for me of like we have to keep talking because there's so many other issues. It's not COVID maybe today, but it'll be something else or it is something else.
Yeah, that's a great example about, especially coming together and sharing expertise and working on small P that turned out to
Mhm.
be, big P at the end,
Mhm.
that
Mhm.
really made a difference in people's lives. So yeah, great example. And the next question I was going to ask you is, can you give a specific example where physician advocacy made a tangible difference? And it's like, well, that was kind of
It
a
was
really big
huge.
one. Can you think of another example where, like a policy was changed or a law was changed or something where, you really feel like you guys pulled it together, especially with the work you're doing now, or you're on the precipice of something, or
I think just having community is really important. I think having that, that connect, like knowing how to tap people, physicians, honestly, I think just humans in general, but especially physicians often don't just volunteer themselves for this work. Unless they feel really pressured. Like I was panicking. I'm like, we have to do something, and there's nobody else doing it. I'm looking around out here and I'm like, I guess I'm the public health person, so I guess this is where I land. But people stepped up. Once I stepped up, like other people did so much. And so it just took that toe in the water. And I see that with other things. I just kind of keep a running list in my head of where people are practicing. And if there's a senator who is sponsoring a bill that I know is important to medicine, I reach out to those people and just say, hey, this hearing is next week, or this is going to be on the floor. It's really important that they hear from you. I imagine this is important to you. And most of the time, people say, I had no idea this was happening. Thank you so much. And I think they follow through. Sometimes I know they follow through because they tell me, and then sometimes I don't hear back. But I usually try to give them really specific information like, here's the senator's email address. This is the link to the bill so you can read it. This is the too long didn't read summary. And then here are some, like, if there's resources that the NMA put out so that they have a way of putting it together. And then I say, I'm happy to help in any way to formulate an email so that it's as like a nice little package for people, as simple as possible. But I find that people just need to be tapped. And people are interested, they just don't know how to get started. And so
yeah,
if you know how to get started or where that pinch point is, just reaching out and helping somebody step into that is
yeah, it can
helpful.
be intimidating. So it's like they just need to know we're here to help.
Well, and even it's not just physicians, there's so many health topics that affect nurses and pharmacists and just the delivery of care that those people are
Yes.
also. And so just, reaching out to colleagues and saying, the nurses on your floor, hey, this is going to affect our patients. This is what's happening. Here is the same thing. Give them the same package that they can share around and make it easy. to do a quick advocacy work. Submit your testimony online. This is going to go to a committee hearing.
Yeah, excellent. So, what advice would you give to physicians who want to integrate advocacy into their career at different stages, like early career, career, and nearing retirement?
Boundaries is the first word that comes to mind. I think it's really easy when you step up to do things to keep asked, like people just keep asking when you put yourself out there. And I do think that that's a barrier too. People know that inherently. And so just kind of understanding what your limits are when you step up to do something is totally okay. Like I can do this, or I can participate in this way. This is an important thing for me. I'm gonna just kind of watch and what can I do? I might help be able to facilitate the community. And as a young physician, that's probably one of your best resources. You know so many people coming out of training really, really well, that you probably are one of the better resources for being able to tap other people, build that community, build those communication networks, that are so necessary, to amplify important healthcare, messages. Um, Also, just knowing like, your time is valuable and sometimes you don't have to do all the things. I think it's hard when you first start and you're not sure how to navigate a system. You can spend a lot of time spinning your wheels and doing work that just really isn't impactful or effective. Um, and just know that there are, there's going to be some mundane moments or things that don't go, you're going to go and speak or spend some time and it may not go your way, or you may not get what you want, or understanding the legislative landscape. This can be really hard, and it's something I'm just learning where it is something it's really important to you, but the way the politics are happening in the unicameral, there's no way this bill is either going to move forward or it's certainly going to go flying through. And understanding that without taking it too personally, but what energy can you put towards it that you're going to feel good about but not burned out, I think is that just takes some time and some skill. And if you're like, this is going to kill me, then maybe just step away from it. And that's where resources like the NMA can be really helpful because they'll be like, this is the landscape. This is what's happening this year. They know who's running for reelection. They know the connections that have been happening for the last year. And so they can say, this is important to you. That's great. You certainly can reach out and they will provide that support, but they'll also say, this is also not where we can put a time and resources because it's not the thing that's going to happen this year for X, Y, and Z.
Yeah. Yeah. There's a snowball's chance on this one. This one has
Yeah.
a fighting chance. Go.
Yeah. And that can be really hard to take,
It is.
It can be really painful because you're like, this is so important. And it doesn't mean that your view about how important it is wrong. It's just what's happening. And I think that that's a lesson, if we would have been a little bit more preemptive about that, it may not have even made it to the legislature in the first place. I think there's a lot of things that get to the unicameral that really should be taken care of outside. It shouldn't be codified into law or being debated, and it should be a policy within DHHS or something like that, a licensing board. But those things are now making their way into the Capitol. And so I think just being aware of kind of those little P's ahead of time that become big P's if we don't
Right.
take responsibility for them up front.
Yeah. Yeah. That's where those relationships, years ahead of time, like working it earlier, pay off because then sometimes bills can be killed
Yeah.
ahead of
I mean,
time, or they
I
never even become a bill because your expertise is used ahead of time.
yeah, I mean, I think the midwife bills last year are an excellent example. Like that, I think, the licensure and credentialing stuff, that if we had better relationships outside of stuff, it would not have felt like it needed to go to a senator to champion. And I think we could have really created and done a lot of stuff outside of the legislature and it would have never made it. And so I think I just think that that's an example. There's still work that can be done there for sure, but I think that's just an easy example off the top of my head. I think, last year I'm like, how did this even get here? It doesn't even make sense that it's here, but it was and it did. And it was a big deal in last year's legislative session. And I think having if we would had better relationships with other entities moving forward, like in the past and better relationships, not just in formal places, but informally, I think that really would have played out very differently or not even been an issue at all.
Yeah, it's been worked on for, well, there's a 20-year history
Yeah,
behind that, 20 plus year history.
it's
So
hard.
it is hard. It's very
And
hard.
I'm not saying that there wasn't anything. I'm
Oh,
just saying I
sure,
think
sure.
so many people are not aware of how things, they're like, how did this get here?
Yeah, exactly. Exactly. And it is a good reminder of where a starting point could be of just getting more involved, because there will be another bill like that. There will be something else. And as we've seen nationally, the role of the physician is shrinking. And so if we want it to keep happening, do nothing. We want that to change, then start advocating, start building those relationships now, and start making sure that policymakers understand what the job is and what it entails and where the expertise lies. And it's a good point to make, because it takes a long time to develop those relationships and become those subject matter experts that everyone relies upon. Very,
Yeah.
very, very good reminder.
I was sitting on the floor the other day and I was listening to a couple of labor and delivery nurses or nurses working on the floor that are working on their graduate degrees, and they were talking about their coursework, and someone was like, and the advocacy course, and I was like, what? And I did not was not aware, but at every level of their education, they have a course like about advocacy in some form. And I was
Right there.
floored. I was like, I thought, huh, that's fascinating. And it highlighted a lot to me. I'm like, oh, that's why some of these organizations are so much more effective because
You
everybody's
learn.
getting that education all the way through and they're getting it repetitively.
Yeah, maybe we should try some of that. Well, I want to put a plug in for LifeBridge, just to make sure people know that I have coached people on finding their voice and what it is that they want to advocate for, just coaching them through it. Because sometimes it's about finding their own agency to find their voice to do what they want to do. And then I can pass them off to the folks that want to go do the advocacy on a particular topic. Sometimes they come to me when they're just frustrated on a topic and they can't figure out what it is they want to advocate for. So it's not a common coaching topic, but we have done it. So I just want to put a little shout out there for LifeBridge. Um, we're nearing the end. This went so fast. I
They
want
go
to
really
toss
fast.
out for questions. Anybody that has a question, or Lindsay, do we have any questions that we have not answered?
Well, I'll certainly open it up if anybody on the call wants to ask anything. Um, I do know that we had one that came in through our registration, and they wanted to know how can you effectively advocate within a potentially toxic environment? So there maybe their organization, or do they feel like there's some backlash potentially?
That's hard. I think workplace advocacy, we spend a lot of time talking about um, kind of advocacy, the big P advocacy policy, either at the state level or the federal level. But sometimes it's like it's just how people interact with each other, right? And I think finding a support system is always, always so important. Like wherever that is, number one, when you have like maybe it's LifeBridge, you're reaching out to LifeBridge and saying like, I'm having this issue in my workplace and I am not even sure where to even start because it's hard to sort out sometimes when it just feels when it's not a supportive work environment, it's really hard to sort out like what are my just negative feelings about my workplace versus this single issue that I'm advocating for. Or what is even, how do I how do I funnel all of the things into one ask or making it a clear ask? Because sometimes those little tiny steps actually make it clear the path for you to have a better system. And being able to kind of go through that. what are your tools at your disposal, right? Like what things are already in place in your organization of employment to support you, right? And utilizing those things. Who are who are the people that can support you, right? Maybe they're people in your organization, maybe they are people outside of your organization that can give you context or have gone through a similar situation. Um, and then like what is your specific ask and what things are you willing to compromise on? I think is really important. I think sometimes we don't think about we're going in like and this has to be this, but in any advocacy work there's going to be compromise, right? And where are your set points of this is I can compromise on these things and I cannot compromise on these other things, and really understanding that about yourself is really important. And understanding like who are you doing this for? Is this for you? Is this for a patient? Is this for your, like maybe it's for trainees? Really being clear in that piece too, so that when you get in the weeds, you can always go back to, okay, who am I doing this for now? Okay, I'm doing it for this person again. And so when you're asking for help, it makes it easier for people to come in and give you that support if you're really clear and understanding each one of those points to be able to move forward. And then when you get to a point and you're like, this is going nowhere, if you have that list, you can always go back and say, I can't move forward here. I can't move forward here. I can't move forward. I have to do a different strategy, or this maybe isn't going to work. Or, you know what, I haven't utilized this resource. I didn't think about this place. Maybe I really need to jump back in and think about this differently from this perspective. But really difficult work environments are hard. But there usually are some resources available, either through Nebraska. A lot of your medical organizations have resources too. I know the OBGYN world had kind of this informal support resource for a really long time, and ACOG loved it and took it in and now has it formalized through through that organization. And so those places exist. Sometimes they're hard to find, but start with your national organization as a place for help too.
Great. Well, while we were kind of talking about some of that, and Dr. Schaefer had mentioned LifeBridge, I just wanted to put this up here for individuals, especially along the topic of kind of the toxic work environment. That LifeBridge is a great place to start with that and meet with somebody and talk through what is a good course of action. So just wanted to remind people that this is available for all licensed Nebraska physicians, residents, and you can call the confidential line here. Everything is confidential. That is following passage of legislation in 2023. So we are the only program that is protected under statute should you want to bring something and talk about that. And then this program remains at no cost to people using this thanks to um, our sustainability partners here. So we appreciate that they also value, a confidential, supportive place for physicians to come and speak. But so I just wanted to share that quick, but if there's any other questions or thoughts, otherwise, we really appreciate you joining us today, Dr. Crockett. This was really helpful and especially coming up on legislative session.
Yeah, it's going to be an
Thank
interesting
you.
session this year. Thank you very much.
Yeah,
Thank you so
awesome.
Yeah,
much.
thank you for all
Really
the work you guys
appreciate
do. Appreciate it. Appreciate you.
Yeah, thanks so much.
that.